Hi, this is Sergeant Beast Larson. How many times have you heard this? Say, officer, I need to go to medical. Hey, Sarge, I'm bleeding. Sarge, I got this infection. It's really bad. I got a bee sting, spider bite sting. You've heard this. And we all know the officer's going to go in, and I've done this many times. You look at it and you make the evaluation. Does it need immediate attention? Because your policy probably states to tell them, fill out a sick call, it goes up, and then the nursing staff determines that. Well, you have a lot less nurses and no doctor after 6 p.m. So the officer, theirself, or your sergeant and lieutenant, you're going to have to make some decisions. So I read at length today a lawsuit, and the officers actually did a great job. There's some great things. I just want to point out a couple things to remind you of the liability. The male, he was in his 50s, complained of back pain, severe back pain. His legs weren't moving, numbness, partial paralyzing kind of situation. And he kept referring to that. And sometimes his legs wouldn't move, and sometimes he'd move his legs and feet while he was talking. But the officers kept taking him to medical. The nurses tried to evaluate his situation. On the 4th day, the nurse said, I want to do a complete medical history, and asked him to sign, waiver. They wanted to go outside his normally routine incarceration and get a complete medical history on him, and he denied that and refused to sign. So that caused a problem in his lawsuit, because it's hard for you to sue. You're not getting treatment when you refuse to cooperate so they can get your history to better treat you. Common sense. But remember, the 8th Amendment, cruel and unusual punishment, and the 14th Amendment, the due process, the right to get speedy and necessary medical treatment when it's required. And he had some points in both of those amendments that he was suing under. So let me read this to you. No, I'm not a lawyer, but I just want to point a few things out. This is what the courts are holding the standard, and this is the 6th Circuit Court. Ohio, Michigan, Kentucky, Tennessee area. Consequently, liability can be established simply by showing that the correctional officer refused to verify underlying facts that the strongly suspected to be true, or declined to confirm inferences of risk that he strongly suspected to exist. That's what I just talked about. Spider bite, infection getting bad. Prisons aren't the most sanitary place, the jail environment. If you're having a roach problem and a rat problem, they're going to put that in a lawsuit. The exterminators are here every other day, every week for this. So you just got to be mindful. Sometimes, and yes, they do this at the most inconvenient times, at shift change, or whatever, but coordinate with supervisors, protect yourself. I'm pointing to me. Protect me, protect you, protect your buddies. It's worth it to spend a few minutes to go up to medical, let somebody else be in charge, and evaluate that need of emergency treatment or not. It goes further to say the summary judgment purposes, it is sufficient that defendants could have perceived a substantial risk of serious harm, whether in fact they perceived, inferred, or disregarded that risk. It is an issue for trial. So imagine a 50-year-old, and we had older males at the prison that were in wheelchairs. Substantial risk to serious harm, what we should have perceived or should have known or disregarded intentionally. Can't put an inmate in a wheelchair, in casts and crutches, half paralyzed in GP and around other people that can harm him. If he can't defend himself, he can't be there. So all of our wheelchair patients were in the tier units, the behavior units, either in a one-man cell or with somebody that they expressed they were 100% comfortable with, maybe another medical situation of that inmate. But it was discussed, and it was very particular who we put those with to prevent what I just read. You don't put opposite gang members, rival gang members together in a cell. Think about that same liability when you're dealing with the medical side of an inmate. I'm going to read another paragraph here that was important. In medical context, an inadvertent failure to provide adequate medical care cannot be said to constitute an unnecessary and wanton infliction of pain. Inadvertent kind of means accident. If you accidentally do something or don't do something, as long as it's not intentional, it's not wanton infliction of pain. Accordingly, a complaint that a physician has been negligent in diagnosing or treating a medical condition does not state a valid constitutional claim of medical mistreatment. When a prison doctor provides treatment, albeit carelessly or inefficiently, this is like 3 words put together, inefficiously to a prisoner, he has not displayed a deliberate indifference to the prisoner's needs, but merely a degree of incompetence, which does not rise to the level of constitutional violation. Now, what that means, deliberate indifference, that's saying, well, you're an inmate, you're not dying, you got one eye open, you're breathing, you're talking to me, you're not dead, fill out a sick call and wait for them to come see you. That's deliberate indifference. Intentionally showing indifference because they're an inmate. Okay, let me read another thing to you here. This is also important. The doctor in this lawsuit, the medical staff, nursing staff, was subcontracted the way most of prisons and county jails do, through healthcare provider. The doctor claimed that he could not be sued because he was a subcontractor, not a part of the contract health partner. The contracted health partner hired him to be the doctor. The Sixth Circuit Court came back and said, wrong. Anybody employed to work at the prison, regardless if it's coming from the check from the state, the city, federal agency, or from the health provider, the local health provider, he's paid to work in that prison, he's liable for his actions. So that doctor tried to skate his way out of this. And the doctor got sued because it took way too many visits for them to order a simple x-ray and see the spinal compression and damage over the years of his life, but he didn't need specific medical treatment. He was not getting it. Now, with the complaints he had coming in, the first or second complaint, maybe you're not going to rush to do an x-ray. But in the reading of this, by the 4th complaint and his complete medical history, that's the point that it should have been done, and it wasn't. It wasn't until almost a month later. While medical malpractice does not amount to a constitutional violation, a prison doctor has a duty to do more than simply provide treatment to a prisoner who has a serious medical need. Instead, the doctor must provide medical treatment to the patient without consciously exposing the patient to an excessive risk of serious harm. So the doctor has to make a decision. The doctor can't say, you're in prison, this is what you get, and that's it, out the door. You can't just stick him in isolation and that's it, solve a problem out the door. Well, if he's by himself, he'll heal over time. The doctor still has to provide medical care and not allow him or intentionally put him in more serious risk. And why am I doing this video? Why am I saying all this stuff to you? Because I want you to think when, say, officer, I need to go to medical. You need to realize all these people. And in here, the doctor, the jailer, the county jailer was sued. The county itself was sued. The doctor was sued. The medical nurses, there was 8 or 9 of them sued. About 5 officers. Right away, they determined the officers did nothing intentional. And there's another paragraph here that I'm going to read about the mental state of mind here of the officer. But the officers were not found to be at fault in anything. And only 2 of the nurses were found to be at fault because both of them used, and I have to go back to look at this exact wording right here, deliberate indifference. One of them, when he went up, he said something was it. The nurse gave a 2-minute evaluation, sent him back, said he didn't have a problem. Nothing more than a day before. In 2 minutes, an evaluation and sent back, that wasn't enough time to determine was anything different. This is what I'm getting at, these quick decisions to say no, and leave them there. Yes, there are times when they make up stuff. Yes, they lie, they manipulate, they exaggerate, Maybe they need to go to medical because their roommate's up there and they found marijuana in the system. There's many reasons. I'm reading this to you, and I want it to serve two purposes. Number one, to seem real complicated, and that's why I'm reading directly from the citation of this lawsuit. But I want you to also realize it can become so complicated in your life. The two biggest trials that we've had, in my opinion, in our history in the last 50 years is OJ and this impeachment of Donald Trump. You can say and talk and present mountains of evidence. You could confuse all 10 out of 10 geniuses by the evidence and what they've presented. Does that make sense? I'm trying to help you so you don't get caught up in a situation that requires mountains of evidence and testimony and days and weeks in court to clear you, to exonerate you of any charges. So that's why this is important. While medical malpractice does not amount to a constitutional violation, I talked about that. When deciding deliberate indifference claims, deliberate indifference, that means you intentionally ignored or showed indifference because they're an inmate. You treat them different. It's kind of called stereotyping. Maybe, there's other words that go. When deciding deliberate indifference claims against multiple defendants, the court should consider whether each individual has a sufficiently culpable state of mind. Therefore, the court will analyze each defendant individually. So if there's 3 officers that have went by and checked on the inmate, signed off on the 15, 20, 30-minute door chart, and all 3 get sued because they were the ones there that day, or that 24-hour period of time, or whatever that time period was, what's the mental state of these 3? Are any of them trying to do this? You're an inmate, you deserve it? Or are they actually going, looking in the window, are you okay? Do they spend a few seconds? Do they show that they're actually trying to have, some consideration to their condition, medical or mental condition, and that's why they're there and they're signing a chart? Do they walk by and never look in the window, walk up to the chart, put their initials and walk away and never look? That's what they're talking about, that culpable state of mind. So keep that in mind. Remember the dorms have cameras? Looking up, cameras to the left, cameras to the right. They're there. Stop, look in the window, talk. Ask them, how you doing? Everything okay? If they're sleeping, you don't have to wake them up every 15 minutes, but stand there long enough that you would be observing their chest to rise and their breathing and their body movement. And if you're not sure, tap on the door a little bit and see if they jiggle, see if their arm or leg moves. Think about these things. You're the one that could be named in this medical negligent lawsuit. The last paragraph, indeed, deliberately, indifference may be established in cases where it can be shown that a defendant rendered grossly inadequate care. That's what I mean by not looking in the window and signing the door chart and leaving, or not signing the door chart, or maybe you go 4 hours without coming by. You got to have a really, really good explanation and involvement in something why you didn't. And if you can't come by, why you didn't have another officer in your place come by. Grossly inadequate care, or made a decision to take an easier and less efficient course of treatment. Less efficient course of treatment. Easier. In other words, a shortcut. Don't take shortcuts. Let me summarize everything here. We have responsibility as correction officers. Look in the window, talk, check on people. When they explain that they're injured, get a little bit of history. We all have a notebook in our pocket. Get your notebook out, write down the dorm, cell number, put date and time, inmate name, inmate number, whatever. Put something down that you can go by later and show in court. Yeah, I was here, he complained of this. Write down, in your notebook, no blood. This just takes a minute to save your career and your history. Write down a couple things. No blood, no this, walking, him seemed to be moving fine. I told him to fill out a sick call. Or you see him laying in a pool of blood. Yeah, he was laying in a pool of blood, look about 20 inches in diameter. I was unsure of his medical. I called, had the nurse come, sergeant come down. We took him up. We walked him up. We pushed him in a wheelchair. They used a cot, took him on the back of we called it an ambulance, it was a golf cart, how you got them up there or something. Make a little note like that. You probably have to do an incident report anyhow. But think of the things that you're doing. Is it going to cause you to get sued? Is this walking by, and I know you say stuff to them and tell them, and I've heard things like this, you're breathing, you're talking, you're not dead. You know, F off, whatever. Things get said to them. You've got to have observation skills. If they're complaining of something that seems to be pretty kind of medical, say, let me go call the nurse. You go up there, call the infirmary, see what they said, and go back. If you're not going to be taking him, go back. Be seen on camera standing in front of the door, talking to him, explaining this to him. And then maybe do some other work where you stick around for about an hour and make sure you walk by him 5 or 6 times in that hour, at least. Make it a good appearance on the camera. Make a good impression on this. That's going to go a long way when you're saying, nope, they told me they weren't going to see him do a sick call, but I still had a little bit of feeling. I still was a little bit, curious and cautious. So I kept going by and checking. Hey, how you doing? Today's Tuesday. Anything going on with your family? Every now and then have a little brief conversation. Think about what you do. Don't just blow them off. Say, officer, I need to go to medical. One of the things that we hate to hear. It's in our top 3 list of things we hate to hear. But you got to give it a little bit of time and effort. You got to give it some professional care, one way or the other, with some professional documentation. That's important. I hope you enjoyed this little bit. Hit the like button, hit the share. Don't forget to subscribe. I'm going to do a lot more of these types of legal things. I've talked about Miranda. I've talked about Garrity, some different things. And the reason I'm doing this is I'm considering running for jailer. I live in a state where the county level detention is ran by an elected official. The sheriff is elected with his deputies. The jailer is elected with his deputies that run the jail. 2 separate things. So I'm researching and doing more. I've worked in both, and I'm considering running to be a jailer, to be in charge. So I'm getting deeper and deeper into things that are recent problems in the last 10 years. The last decade of lawsuits. What is the cause? Lack of this, lack of that, lack of training, lack of whatever. What are the things that the inmates, the prisoners, the detainees, like the St. Louis riots, what are they complaining about? What's the pattern of these things and how are they resolved? So I'm here. I'm here for you. I'm here for me, for all of us. See you soon.